Stand.
Stand on the table.
Unstable. George Parr, you are in charge of the Commercial Directorate of the Department of Health.
That's right. We are responsible for the interface between the National Health Service and the private health sector.
What does that mean?
Well, it means bringing the entrepreneurial skills of the private sector into the NHS, speeding up innovation and increasing its capacity and making it much more efficient, getting more value for money, a bigger bang for the taxpayer's buck.
That certainly sounds good. And how are you doing that?
Well, a good example is the Independent Sector Treatment Centre programme. These are privately owned centres spread across the country doing hip and knee replacements and cataract surgery for NHS patients.
Well, that's interesting. How many treatments are they doing?
We've negotiated contracts with private companies to do a total of 170,000 treatments a year over 5 years. The first one started in October 2003.
That seems impressive. And they're already doing that?
No, not yet.
How many are they actually doing?
So far, they've done about 180,000 altogether.
Altogether? You mean since 2003?
Yes.
But that works out at only, let's see, 45,000 a year.
That's true, but it's early days.
But I thought you said these were 5-year contracts, and they've already had 4 years.
You have to remember, these are complex operations on real people. It takes time to get them right. You can't rush something like a hip replacement. It's not like repairing a car.
I can see that. But still, the operations they are doing are better value for money than if the NHS did them. They're more efficient, right? They cost the NHS less.
I wouldn't say that, no.
Why not?
Because they cost more.
More? How much more?
Oh, I'm afraid I can't tell you that. It's commercially confidential.
Let me see if I understand this. They're a bargain, but they cost more than if the NHS did them.
It's hard to explain to someone with no commercial background, but there are many costs faced by a private company that the NHS doesn't have to pay.
Such as?
Well, for instance, preparing bids for the contracts. And there are risks to take into account.
Oh, you mean things like the risk of lawsuits for criminal negligence when things go wrong?
Well, actually, that risk is covered by the NHS.
Really? Oh, but there must obviously be other risks. So dealing with risk is what the private sector does best, isn't it?
Oh, absolutely.
I suppose one big risk is that patients may not choose to come to the new private centres.
Well, that risk is covered by the NHS too.
How does that work?
Well, the contracts provide that the private company is paid for the number of patients included in the contract, even if they don't show up.
You're joking.
Well, no, not at all. You can't expect a private company with shareholders expecting at least a 20% return on their capital to go into business doing operations for the NHS and then find it has no patients. That would be commercially ridiculous. They would never do it. So we had to work out contracts that would eliminate that risk.
So, if the contracts say that these companies are to do 170,000 operations a year, but they're actually doing just 45,000, they're being paid for, well, let's see, 125,000 operations a year that they're not actually doing?
So far, yes, but you have to take a long-term view and look at all the other risks they have to face.
Oh, then what are the other risks that these private companies face?
Well, the main one really is that the public might decide that the whole thing is nonsense and the programme will be closed down.
I can see that that is a real risk. So what you're saying is that the public is paying more for the work done in these centres than if it was done in the NHS, to cover the risk that we might find out that it was all a waste of money.
That's one way of putting it.
It does seem complicated, but obviously that's what the Commercial Directorate is for, working out these complicated contracts. It's quite a big organisation, isn't it?
Yes, it is. There are 190 of us recruited from the private sector.
All of you?
Well, no, just 182.
182. So the other 8 are regular civil servants?
I suppose so.
You don't know?
Well, I haven't actually met them.
Oh, well, what do they do?
Well, to tell you the truth, I've no idea. I can find out. Perhaps they make the tea.
But your commercial staff, the ones from the private sector, are the ones who do the technical work of negotiating these complicated contracts with the private sector.
Oh, that's right. They bring their private sector skills and contacts to the job, and their understanding of the needs of the private sector, how the market works, the value of competition.
So that's why the NHS is paying on average about £120,000 a year for each of them.
Something like that, yes. And the Secretary of State also relies on us for advice.
Oh, I see. So when Alan Johnson said the other day, for example, that he thinks competition is good for the NHS, he was relying on your advice.
Precisely.
And relying on the evidence provided by your highly paid staff with their combined commercial experience.
No.
Oh, why is that?
Well, there isn't any evidence.
George Parr, thank you very much. So that's it, folks, and thank you very much for putting up with us.